you listen to the music?
Yes, sir.
Okay, just do some box breathing. Okay, before all the join, just close your eyes. 4-second inspiration, pause, then hold for 4 seconds, then expire 4 seconds, then hold. Do that. Like, it will heal yourself. Yes, Shikha. Already I logged in through launch. How to do that? मैं Zoom ने इधर रिकॉर्ड बोल दिया वो क्लाउड में बोल दिया Zoom में. Because how to do it through Graphy, I don't know. You have to tell me. You can do from your side because you also admin, huh? No, not yet started. You can still do recording. But I have not yet started. Just I have put the music. People are coming in. You better, Shika, you record from Graphy side also.
Please, it's a backpack. Always, yeah.
Hello. Am I audible, Dr. Deepak? Hello.
Hello, Avnish, you are audible.
Yeah, hi. Sorry, everyone. There was some technical issue.
No, initially it happens. First time you are logging in through Graphy, no?
Yes.
So
So
what
my
was the
email,
problem?
the email ID was different. Actually, there are two email IDs. So both email IDs were there on the platform, and one email ID was not assigned to the course. So it got corrected now.
So now it is okay, no?
Yeah. Now it is okay. So we can start, I guess.
Now we'll wait for 2 minutes
Okay.
because this is the first one, no? It happens.
Yeah.
Now we have 33 participants who joined. We'll wait for 5 minutes.
Sure. Let everyone get solved with the
First time,
technical.
no? We'll give some time.
Sure.
Good evening, Deepak sir.
Good evening, Vanke.
Sir, ಚೆನ್ನಾಗಿದ್ದೀರಾ?
Fine.
Nice.
I have shared Shika's number in learners group, the first batch. If anybody has difficulty, please call her. She will be there till the end of this live class.
I'm just checking my screen, sharing.
Yeah. You can share your screen.
Yeah. Okay, it's working. Yes.
Working, no?
Yes. So meanwhile, while we are waiting, those who have joined, please introduce yourself in the chat, where you are from. I think Dr. Deepak knows a lot of you, but I'm meeting many of you for the first time. Good evening, Dr. Aruna, Dr. Ananya, Dr. Raghavendra, Dr. Sumera.
I think we can unmute all.
Yes. Yeah. Please feel free to unmute, introduce yourself.
You can unmute yourself one by one.
Yeah.
I've given permission.
Yeah. I'm Dr. Raghavendra Vanki, consultant pediatric intensivist and professor at SN Medical College. and lead consultant at Keredi Hospital. So I've been closely associated with Deepak sir, and of late I've been AI generalist.
Hello.
AI in our pediatric field.
Hello, I'm Dr. Sunita Katyan from Ranchi, and I am a practicing pediatrician for the last 40 years, but have got very interested in this AI and how it can do work for us, especially research. So, good evening, Dr. Deepak and Dr.
Good evening, Dr. Sunita. Nice to have you here.
Sunita,
Yeah. Mute one by one. Unless we are speaking, let us keep on mute. Yeah. Next. Yeah.
I am Dr. Aruna. Good
Hi.
evening, Dr. Deepak and Dr. Avinash.
Good evening.
I am working in Indira Gandhi Institute of Child Health in Bangalore since 20 years.
Very
I
nice.
am presently a clinical geneticist and a metabolic physician.
Wow.
And I'm also in charge of a nodal center for newborn screening in our hospital.
Mm-hmm.
And the government of Karnataka has launched the newborn screening for 5 disorders since January. So we are having lot of data from patients from samples which we are receiving from the entire Bangalore city, both urban and rural. So I connected with Dr. Deepak to help me
Mm-hmm.
make the data more organized and so that we can issue the reports to patients as soon as possible.
Very
That
nice.
is our goal. Within 3 days of receiving the sample, we should give the reports to them.
Very nice.
We are managing with Google Sheets,
Mm-hmm.
but recalling patients has become a challenge. So maybe with time I will be able to organize it much better. Yeah. Thank
Excellent.
Dr.
you.
Aruna,
Yes, sir.
I think in the open group as well as in the your batch group, I mentioned about one of the autism case diagnosed with using molecular techniques from someone private lab, where the common pediatrician was not able to interpret the report. So we use the AI tools Claude to interpret it. That I have posted. I think you have seen that.
No, sir. I will check with it, sir.
It's a
Yeah,
case of
because
inbound error. Yeah, it's a
yes, sir.
case of inbound error of metabolism with
Hmm.
autism.
Okay, yes, sir. About 15% of patients with autism can have a variant,
Yes,
sir.
yes.
It's nice
I
that
think
people have identified, sir.
yes. So now it is 5:14. Without
Hmm.
wasting much time, we can interact. Next 5 weeks, we are all with. We can interact each other. Some of you have put it in the chat box regarding your introduction. That's good. I think better to start the program. So good evening, each and everybody. We have around 36 plus members, and people are going to get added. Um, Welcome to the first class, the first module of AI in pediatrics, specially made for you people as per the need of you. We thoroughly 1.5 hour we curated on the need base of what you want. Just yesterday, maybe around more than 8 hours, I stood up in front of 60 people in Bangalore workshop in Raja Rajeshwari Medical College. Till 5:30, 6 o'clock, people are not want to leave the hall. We made such a hands-on demo of few tools, common things what we are there in pediatrics. So it was such a wonderful interaction. So with this few words, so in this module we are going to teach you the basic part of artificial intelligence, how you get ready or prepared to face or use this artificial intelligence effectively in your hospital, also outside the hospital. So Dr. Avnish is going to take the first, he is going to face the first ball. So he is going to teach you how you have to be prepared, what is the best setup you have to make. After that, I will take the next part of the AI preparedness, that is a digital software, what you have. What is the ideal software, whether it is offline, online, traditional, AI enabled. And I am going to show you the one of the best AI enabled software, that is Glass AI. And also 3 people are demonstrating you 20 minutes each between 6 o'clock to 7 o'clock. So please see the demo and take their number. If you have any doubt, you please ask them, and it's up to you which one you want to choose. We are not recommending anybody. You are the one. You can go through the detail, and whichever feels you are very used to it, just like selecting the car, you can choose it. With this, I welcome all of you once again, and I also welcome Dr. Avnish is a faculty. I think he has already introduced in our OA orientation class, and other faculties who are able to join. Over to Dr. Avnish. You can start.
Thank you, Dr. Deepak. Can you make me co-host? Can you just check once?
I think you are the host. I think because
Yeah, no, I think I transferred it to you. Can you check once?
yeah.
And also, I would request all of you to please mute yourself. My voice is not clear. Is it clear, Dr. Deepak?
Yeah,
Hello?
yeah, it's clear.
Yeah. So if you can just make me co-host, I can share my screen.
Yeah, I will do this.
Yeah, and everyone who is not speaking, please mute yourself so that there's no disturbance for everyone. We will discuss in the end. We will have a Q&A where you will unmute. For now, just mute yourself. Yes. Okay. Okay, so let me get started. I'll share my screen. And I can see that people are joining in the background. Okay. Okay, so I hope you can see my screen, you can hear me, you can see me. If you can, just write a yes in the chat box.
Yes, Avnish, you make me co-host.
Okay, let me check. So it is telling me to make host. If I make you host, it will transfer to you.
The co-host option is not there. It's okay, no problem. You start presenting.
So after my presentation, I will transfer it back to you. Is that okay?
Sure.
Yeah.
Sure.
Okay, so I will keep admitting people, no worries. Just write in the chat, you can hear me, yes. Okay, Dr. Krishna says yes. So I will proceed now. And in between, I will check the chat, don't worry. I will keep checking this one. I will keep admitting, no worries. Okay, so welcome all of you. This is your first class, and it's always, this happens in all courses, don't worry. This initial glitch happens, and because this is a new LMS, this is Graphy. It's a very good LMS and very nicely built. Only we have to get used to it, and maybe by next class we will be experts at how to handle all these things. So we all are learning, and I appreciate your patience and the way Dr. Deepak is handling all this. I can see in the WhatsApp group and everything. So I appreciate that. And also Sakshi from the Graphy team, very helpful. So the first part of this today's lecture is about 30 minutes around I will take on this topic, which is to get you started. So this course has been designed a bit different from other courses. So we are not going to go into very like a very basic ABCD. We are going to take you to what is actually important for you as a pediatrician, as a clinician, that can help you for using AI safely, for integrating it in your workflow, and what pitfalls you should avoid. I think these 2-3 things are very important for any clinician, apart from knowing the theory of AI that you can read. There are many videos on YouTube. We'll be connected over 5 weeks. You can ask us on WhatsApp group. We'll be happy to answer and help you. And also you can ask AI tools about common definitions. So that we will not cover to save your time and to give you maximum value. So our philosophy will be where AI saves time in pediatrics and where it must never replace clinical judgment. So this is the core message, that you are the clinician, you are responsible for the clinical judgment, and our aim is not to replace you, but to augment you and to make you more efficient and to help save time using this new technology. This is just another technology like internet, laptop, mobile, all these new technologies. AI is also one of them, and it is going to affect our lives as clinicians. So we need to know about it. Okay, so go with this mindset and you will enjoy this course, and believe me, after this course you will be very confident, and you will be using all these tools to make your work more efficient, and my best wishes to you. Okay, So these are the learning objectives for this initial 30 minutes. We want to see what are the pediatric workflows where AI can help you realistically today. Anything AI can do, but what realistically it can help you with, those 3-4 things we'll look. And as you move on in the course, in the other modules, you will see hands-on live all those things in detail. So I will show you 1 or 2 demos depending on the time, but then in detail you will be seeing all these workflows in these other modules. Then you have to know how to distinguish safe clinical augmentation from unsafe dependent. There's a very fine line. There's something called automation bias which we'll see, and we have to avoid that. So how you can do, we'll see. I gave an exercise on the group also about prompting. So we will see how to apply structured prompting method so that you can get good response. So I gave you 2 prompts. One was a very basic prompt and one was a well structured prompt. And I hope many of you did that activity and you saw the difference. So the purpose of that activity was not to tell you that use AI for this purpose, but to show you the difference. Okay, CDSS, we have some very good tools. Dr. Deepak will show you Glass Health, and there are some other demos from other EMRs. So you will see all those more polished tools. And finally, I will give you a checklist. So how you should be careful before using any AI output. But let us first look at the story. Okay, I think anything becomes valuable, or anything makes sense when we have a story attached to it. So let me start with some story and some numbers, and you all will relate with this. So this is the KAP study done among pediatricians, and we also did a small study on our WhatsApp group using polls. And this is what is generally found, that 91% people understand what AI is. And these people are especially pediatricians. They understand what AI is. There's no lack of understanding, but only 34% know what to do with it. How do I use it? How do I apply it to my workflow? How do I actually get value out of it? These are the real questions which are not being addressed. There are some courses out there now. There are many good initiatives happening, but still many are not specialty specific. Sometimes they are not able to give you the use case which is relevant to you and your specialty. And this gap is exactly what this session as well as this course will be addressing over the 5 weeks. So I request you to please be very attentive. Just for these 2 hours on every weekend, just forget everything, remove all your distractions. And if you're not able to attend, please go through the recording, please communicate with us, take maximum value out of us. I'm not saying that we are experts and we know everything, but we are learning a lot every day. Maybe tomorrow I will be more learned than I am today, and I can maybe share some more things with you. So this is a continuous evolving process, and I hope this number of 34% will become also 99% in times to come. This is our larger goal. So what has happened, what has changed in the lives of pediatricians over the last like 2-3 decades is that we have shifted from this large infant mortality rate and large under 5 mortality rate to better numbers. See, our country is progressing, things are changing, our lifestyle is changing, more people are now aware about these problems which they should be careful of. They are taking care of lifestyle, they are going for institutional births. So all this thing has led to drastic reduction in the things which we were trying to address over the last 2-3 decades, which was IMR and under 5 mortality rate. And now what has happened is, due to lifestyle changes, due to many other things, the burden has now shifted to chronic care. You must have seen this transition. Many of you on this call who are senior or maybe practicing from 2-3 decades, you must have seen this transition happening. And what pediatricians do every day has changed a lot in the last 2-3 decades, and now more focus is on chronic care, neurodevelopment, preventive counseling, parent counseling. All those things are now coming in, which are more of documentation or admin tasks, and like the thrill of treating the patient. I'm not saying it is gone, but a lot of things have grown around that thrill, and those all are also equally important as our profession, as part of our profession, and we have to address those, and maybe some way we can use to make us more efficient in those tasks so that we can do more of what we love. I understand, as a clinician, I have practiced pain medicine for 10 years, anesthesia, critical care. I know the maximum thrill that we get is when our patient gets well and smiles back to us. That is and sometimes parents thank us. So that is what we want to do more of, instead of focusing more time on just doing this admin tasks and putting notes in EMR. I don't think that is what we doctors are meant for. And this is a study from US. We don't have much of Indian data because there are not much EMR usage, but and we'll see in this session towards the end there are 2-3 EMRs, and maybe some of you will be using more EMRs as you move on, because government is very supportive of this digitization of healthcare data. One of the reasons is because once you have digital data, then only you can train AI models and you can measure things better, and then when you can take policy decisions. So they want everything digital, and sooner or later we will be moving moving down this path, and similar kind of data will come for us, which will be physician work week on an average. Out of that, pediatric EHR time per day is 4.4 hour, and not just this, it is 0.8 hour at home also. So 1 hour after your shift, after your duty, when you should spend time with your family, when you should be giving yourself time to relax, that is the time when you are creating new documentation, you are giving reply to emails, you are reviewing some existing data in the EMR, which is not okay, right? Because there's something called the quintuple aim of healthcare quality, where physician experience is also one of the factors which should be very good if we want to give good care to our patients. So if we take good care of our physicians, if our physicians are not burnt out, they are better able to do the work, then it ultimately transforms into better patient outcomes. Okay. And yeah, I can see people are keeping on introducing in chat. Please keep the chat active. Please share your thoughts. This is not a one-way lecture. This is going to be interactive. Any questions you have put in the chat, any thought you have put in the chat, please keep yourself on mute. We'll allow everyone to unmute in the end, but you can use the chat as much as you can. So if you talk at numbers, this is a snapshot. See, 91% understand what AI is, 34% only know what AI tools and how I should use, what I should use, where I should use, and almost 50% say workplace is not equipped to deploy. Many hospitals in India, they are still working on pen and paper. AI is a very far-fetched thing, which if you talk to your hospital CEO or admin, they will say first do your clinical work, then only we'll be able to think about other things. So priorities are not aligned, I would say. Different setups, different geographies. There are some problems in rural areas which AI definitely cannot address. So all those things have to be seen. 84% but people, pediatricians population, they expect AI within a decade. So 2026, so I would say not even a decade, I think within next 5-6 years, we'll see a huge surge of AI tools coming in, specialized AI tools, validated AI tools, which pediatricians can use for giving better patient outcomes. And one good thing is that 91% people want to learn more. And I'm really happy to see that so many people have joined this course, that we had to start a parallel batch which will be starting 1 week after. So we overshot the seats and we had to start the second batch because of such high demand that people want to learn, which is a very, very good thing. People want to learn, they want to use these tools for better patient outcomes, for improving their lives, for reducing burnout, all those things, so which is very good. So gap is not awareness, it is actually application, and that is what this course will address and what we will be learning over these 5 weeks. So I have been told by Dr. Deepak to face the opening ball. So this is, I'm just trying to give you the boost and a picture of what will be there over the next 5 weeks, so that you are excited and willing to spend time with us. So simply, if I say what AI actually is, this is an entire lecture in itself, and there are many people who are dedicate 1 or 2 hours to this topic. But see what happens, you don't need to understand the technology so much as you need to understand what it does. So AI is a very broad field. First thing you should understand, AI is very broad. Everything is AI under the sun. But what AI you will be using more is called generative AI, because that is the AI which became popular after 2023 ChatGPT, and now you have so many tools coming up and they are easily accessible to you and to your patient also. The parent of the child coming to you as a patient is already using these ChatGPT and all these tools. So as if Google was not enough, now we have another thing to deal with. which is called AI, and AI is nothing like Google. It is absolutely different. It's another beast altogether. We cannot compare it to Google. We cannot say to the patient that Google galat hai, Google is wrong, and this is also wrong. No, because now it is also giving citations, it is giving references, it is adding so much of knowledge behind what it is giving answer behind that. So it is reasoning. So it is difficult. So we need to understand what it is and what is LLMs. LLMs is the short form of large language models. Don't worry about any word. If you are starting from scratch, just ignore this word. It is a type of generative AI. And what does generative AI do? It generates new things based on the data that it has seen and learned from. So large language models have been trained on large amount of language, which can be internet text, it can be books, it can be speech. So all these things it has been trained on, and then the model is now what it is doing. It is just predicting the next word. And the engineering word for word is called token. Okay, I hope this is easy for you. So I will give you example. In exam we used to get question, the cat is dash, the boy is dash, the girl is dash. Now it is up to you. What do you want to fill? You want to fill the cat is sleeping, the cat is brown, the cat is black, the cat is drinking milk. It is just prediction what we are trying to do. And how we do this prediction is we take the context. So if there is a story and then there is a question asked to us that what is the cat doing, we can predict better, right? So similarly, LLMs are next token prediction engines. They are just predicting the next word in the sequence, and they do it at such a high speed that they are able to generate text as if they are writing the text. So now you understand that the next word can be brown, black, sleeping, drinking, walking, anything, and everything is right. But in that context, what the AI tells you and how you interpret as a clinical judgment, that is your human plus AI moment. It is never going to be AI alone, which is going to know whether it is black or brown, what is the correct answer. Every answer is correct for the AI. But for you, what is the correct answer? That is where your role comes in. So just to simplify, they compute the statistical probability of the next word. They make a probability. In maths you must have read, like they give probability 100% to black, for example, then they give 90% to brown, 80% to walking, and then they push the most probable word out. So this is based on patterns in training data. So if there are any biases in the training data, then that also get fed in. And this is their pros and cons. So they can predict very fluent, well-structured text because they have learned from what we have put on internet. We have written the books. They have learned from that. They can summarize, rephrase, translate. They're very good at that. And they can have a coherent conversation with you. They will make you believe as if they understand you. But actually they don't. They are only working on the pattern that they have learned. They cannot possess clinical reasoning. They can mimic clinical reasoning, but they cannot possess clinical reasoning. They cannot understand biological mechanisms. They can try to show that they understand. They cannot exercise ethical judgment. They can show they are ethical, but they cannot actually exercise ethical judgment. They cannot know when they are wrong. And also they cannot show empathy. They cannot feel empathy. They can show empathy, but they cannot feel empathy. So all these subtle differences you need to understand. And AI does not think, it just predicts, and that is where every time you have to review its output. Why we tell you that always check the AI output? Because it is just predicting. It is predicting the next word. Maybe its prediction is wrong. So now they have got better, the models have gone better, but you have to be careful. So now I hope in this one slide, feel free to go through the recording again, feel free to ask me any questions later. It's very simple. The more you learn about it, it becomes simple. But this is how much you should know what AI actually is. I think more than the technical definitions and all those things, I think this is more important for you as a clinician. Now there are two types of uses of every technology: nuclear energy, electricity, cars, any technology, name it. You can have a good use, safe use, and a high risk use, which is blind use and it can cause harm. So now it is up to us as human beings to decide what we want to do. We want to use it safely to augment ourselves, or we want to blindly use it for any other task. Both are possible, both are being done, and there are enough examples around you of both those things. Maybe your patient will also come to you someday having done this high risk blind use. So you as a doctor, it is your responsibility to teach them that no, this is not the correct use of AI. How you should use AI? Come, we will sit together, we will use AI together, and I will teach you how to use AI to understand your condition. This is how we should think about this. Okay, and more clinical judgment a task requires, the less autonomy AI should have. There's no doubt about this. Okay, so we cannot allow you to record to your computer, so please don't try that. I got some notification. You will get the recording on the Graphy platform. Don't worry. You can access that.
We are recording both Zoom as well as Graphy.
Yes, yes.
Whichever is the best, it will be uploaded to this Graphy. Yes. Anytime you can see, and you can comment, you can chat with us anytime through this Graphy.
Yes.
Yes, Avnish.
Okay, so see on the left side you can see safer augmentation things. What you can do, you can draft some notes from your bullet points. SOAP is nothing but subjective objective assessment and then plan. This is a type of a clinical note you will see in the EMR when we will see the demo today. Then summarizing long referral notes before the rounds, rewriting explanations for patients in plain language, drafting discharge summaries, educational handouts, structuring WhatsApp replies for common parent queries. But of course, all this you have to review. There is no question. Now I will not repeat again and again. You have to review the output because it's just a prediction engine. It's a very good prediction engine. And these are some high risk blind use cases which you should not do. I mentioned on the WhatsApp group also today, making a diagnosis without physician assessment. This is not what I want you to do using ChatGPT, and even your patient should not do it. And if they do it, you should educate them that they should not do it and why they should not do it. And now you will also understand why AI gives a different answer in every time, because it is predicting, it is only making probability prediction. So every time you put, even if you put the same prompt, the answer will be different because every time the probability of the word will change. And that is why it is not a very very deterministic kind of an environment. Then always check all the doses, fluid plans. Don't take from AI. You always check your reference books, or you have something like Open Evidence or Up to Date. Go there. Then using AI generated citations. I will show you one example that AI generates a lot of fake citations, and you must have also seen it. Then also teleconsultation via AI without a human RMP making a first call. This is very risky. If someone is telling you make a AI twin and then you can do some consultation, please don't fall into all these gray areas. They are very, very risky. Okay, and always know, my teacher used to say, Avnish, you will be a good doctor the day you know what to not do. I was very confused. I told I am here to learn what to do. I am not here to learn what to not do. It will take a lifetime. And then that is when he said, yes, it will take a lifetime, because that is why a doctor is always told they are practicing. Because every time they make a mistake, we are human, we make mistake, and it's not bad to accept that. And what we learn every time is what to not do next time. Okay, what to do we have learned in our 3-year MD program in pediatrics, you must have learned, but what not to do is very, very important. You have to understand that LLMs cannot assess the pallor, jaundice, respiratory distress visually. You can give an image, it will see from the image, but it cannot see from different angles unless you give the different angle images. It cannot evaluate the tone or quality of a neonate's cry. The work is happening, but still your ears are more trained to understand what a neonate is crying for. I will always believe a physician's assessment more than an AI assessment, that why the child might be crying the way they are crying. Then palpating a distended abdomen. AI cannot palpate, you can only palpate. And also detect smell of ketones in a child's breath. See, a single simple diagnostic cue which a human being can easily pick up is very difficult for AI to do that. I'm not saying AI will not do all this. Maybe AI will improve with time, maybe it will do all these things, but not for a fair amount of time. And this is where you have your advantage. Examination, intuition, empathy, they are in human things. You should focus on those. Never lose these 3-4 skills. They are very, very important for you. And always be aware of automation bias. This is what I was telling. AI can be very confident while it is lying. So imagine a student who has come for Viva in your exam, and you ask them a question and they very confidently answer, but they answer everything nonsense, and you are an examiner, and you sometimes you have to pass the student if they have answered very confidently. Sometimes you do that knowing that they have done it wrong. So there are different things. Our teacher used to say, you can never pass, we only pass the students, you will pass only when we pass you. So that was true, because see, we used to sometimes say, okay, pick this bone, then we used to pick it, then name the attachment, and then we are just blurting out something, and in our brain also we are not able to understand, but ultimately we passed and we did practice for 10 years. So a fatigued clinician, a fatigued examiner, for example, a fatigued clinician is more likely to pass that. Okay, if the first student in the morning in the viva used to be screwed very nicely, the examiner was attentive at every answer they were giving, they were listening very carefully, asking cross questioning, and by the end of the day the viva used to shorten the time from 30 minutes to 15 to 10 to 5. Last student only had 2 minutes viva. So that is human, like our limit, cognitive limit and the risk, so you should be aware about that. Okay, this is one framework of prompting. There are many frameworks out there. So this is why this I am giving you, because you can take a screenshot and use this. There are many other frameworks. How to structure a prompt when you are trying to write a prompt. So we forget. It is like a checklist, so that you don't forget that these all things should be there in your prompt. You should assign it a role. You should tell what you want. Then you should tell it the format, and also you should give it proper context. If you have given all these 4 things, then you will get a good response from AI. If you have not given any one of these things, then your AI will be very poor. And this you saw in your example, which I showed you in your exercise before the class, that if you are putting a prompt which is very simple, one line without any context, without anything, then you get a poor response. And if you give a good proper this thing, you get a good response. Okay, so this framework, just go through it in the recording again. So now let me show you one demo. I know you all did this task, but let me just show it to you. I hope you can see my tab. Let me just check it. Okay, so let me go to ChatGPT, which is the most common, and because let us start with ChatGPT for like Shagun, because if you don't start with ChatGPT, then it is not an AI class. So now this I increase the size. So you can see this is ChatGPT. For those of you who have not used it, this is a app. You can use it on your mobile phone also, and then you can ask anything here. And I can see all of you have used it, because you have put some very nice images on the WhatsApp group. So now I am giving it a very simple prompt: write management for a 4-year child with fever and cough, and let's see what it gives me. And I will open another window, same ChatGPT, and I will now give a structured prompt, which is more structured. So let me put this, and we'll compare these 2 responses to see, and you will tell me which is better, what is missing, what is there. Okay, so see, now here, see, without asking me anything, without asking any more details, without asking any more context, it is behaving like a very confident doctor who can do anything, and it is giving me all this symptomatic management, and even it is giving me the dose. See, this dose, it has not even asked me what is the child, what is the background, is the child having any problem. So this is what happens when you give a very single line response. Very generic answer, looks very confident, very detailed, very nice, but it is absolutely useless. Like, it is garbage in my view. In medical science, you cannot use this. But on the other side, if I give it a task, and then it is asking me case facts. Okay, so let me put the case facts. So when I give a good prompt, it is asking me further details. And now if I put this more details, let us see. So now it is giving me a proper SOAP note, subjective, objective, assessment, plan, parent friendly explanation as well. So see, it all depends. I asked it for SOAP note and parent friendly explanation, very targeted, very focused. What I want exactly from the AI. It is not going into generic response. It is not giving me what I don't need. this is how you should use AI, and the AI tools which are coming now are very advanced. So if you don't give a proper outcome which you want from the AI, then it goes into like loops of misinformation, hallucination, all those things. So you should be very clear in your mind what you want. The better you know what you want as the ultimate outcome, the better response you will get from the modern AI tools. They are now outcome focused. You have to just tell them what you want, and also better to tell what you don't want. Okay, so this was just a demo to show you the difference of what a difference can make between the prompting. So what you saw that the model returned broad differential which you didn't ask for, drug recommendations I showed you, wide range, wide doses I showed you, confident tone but specifics are filled. So it was not useful for me. It is good for fancy thing, maybe the patient will do this, but as a clinician you should be very scope constrained, role defined, facts provided, boundary should be explicit, and output format is specified. Okay, so spending just 30 extra seconds using this prompt framework which I told you, it will help you get better response from AI tools, and to prevent error which might happen if you don't use good prompting in a clinical setup. So this is very, very important. I hope you got the message. And now let me show you the second demo, and after this I'll just hand it over to Dr. Deepak, because we already, okay, so I will go to ChatGPT again, and what I will do is I will put a prompt. So maybe I'm a resident doctor, I'm studying for my class, and I just want to go through this topic very fast. Is latest AAP guideline on antibiotic use of viral URT in children. Provide the citation with author and journal. I'm telling it to provide citation, and I'm telling it to provide author and journal, and see what it does. It very confidently, it will go to the website. It will come out with these very fancy looking names, Harshale, Jackson MA, Hicks LA. You will feel that, okay, this might be a real study, Gerber GS, Jackson MA. And what happens is, my experience, 50% of the time it works, 50% of the time there's no such study. So when I take this and put on google.com, now here where traditional Google helps, I put it on Google and I see. So I'm lucky.
You got muted, Avnish.
Sometimes it gives correct also, and sometimes it gives wrong, but it is your duty to go and check everything. Go and check on Google or any PubMed or any other website if it is giving citation, especially if you are using ChatGPT. Okay, so today ChatGPT is in good mood and it is giving me correct studies. But what happens is, sometimes the title is wrong, sometimes the author name is wrong, sometimes the page number is wrong. So if you directly pick this citation from here and put in your whatever you are trying to put, then it sometimes causes a lot of embarrassment. So be careful about this. When you will ask me, okay, what to do, how to be more safe, then there's something called as Perplexity. So this is a tool called Perplexity. This is bit more citation friendly. So if I put the same prompt in this tool, this gives me a better response. And I have one more feature. If you see this plus sign, you go click on this plus sign, you see connectors. In connectors you can choose academic sources and deselect the web sources. Now it will search only from journals and academic journals, and this tool is also free. You can download it also as an app. And see, now it is going to these websites, latest AAP guidelines. It is telling you what it is doing. So very transparent. You can go and you can check these also later on. And now it has, after completing 5 steps, now it is giving me the American does not have a standalone clinical practice guideline specifically titled. So now see, this is very, now it is telling me, ChatGPT didn't tell me. Now this is telling me there is no standalone clinical practice guideline, but there are some recommendations against antibiotic use, and these are the ones, and this is a citation. And now if I click it, it opens the new window, and I can again check it. It is my duty to check, because even Perplexity can make mistake. I'm not telling if you use Perplexity then you don't need to check. This makes less hallucinations than ChatGPT, but it is always a good practice to check. So I hope you got this message that how you should think about AI with these two demos. We will learn more details and we'll see these workflow cases. You can see how to create a note, how to create a discharge summary, how to create a parent friendly explanation, how to convert it into a patient language flyer to give to the parent of an asthma child, how they should use inhaler, for example. You will see all these tools, notebook, LM and all in next modules you will see, but I'm just giving you an idea that these all are the possibilities, how you can save time from your clinical work and how you can make your process more efficient in your clinic. So all these are real workflow things. Finally, this checklist, this 3, 4, 5 things you should keep it as a screenshot, put in your clinic, put under your table, under the mirror. These are always clinical check. Does this what AI is telling you fit the specific child in front of me? This is always the safety net for your patient. This question, if you ask before using the AI recommendation, this always should be the first question. Then source checking, as I told you, always check the citations, check from tools like UpToDate, PubMed, Open Evidence, go to all those things and your own textbook. Then privacy check, always remove patient information before entering data into public tool. You saw I put the history, but I removed the patient name and everything. There was no patient name, no phone number, no address, nothing. All those things should be removed. Bias checking, always I told you that this AI is trained on data, so that data might be Western data. And if you're trying to apply the same thing on Indian population, then there might be some bias. So you have to be very careful about this. And finally, dependency. Are you becoming dependent on AI? Are you in automation bias? All these things you have to always keep asking these 4 or 5 questions every time you are using AI. So you can use this as a checklist. This will help you become AI ready. This will improve your AI readiness, and that is AI preparedness and readiness is our topic for the first module. Then these 3, 4 regulatory things also you should know. DPDP Act, we'll be taking this in more detail as we move on, and you can go to the website and read these and come back to us on the group and we can guide you. But these are some guidelines which you should be very knowledgeable about. Is DPDP Act, this is for data protection, data privacy. ICMR guidelines for ethical AI, this is also very good guideline. And finally the NMC telemedicine guidelines which are released in COVID time, and then maybe they were modified ones. So you should always be very knowledgeable about these 2, 3 guidelines, because these will keep you safe in the current medical legal context. So finally, in this whatever I told you, only remember one line: AI should save your time, make you more efficient, augment you, improve your working. It should be saving time on wording, but it should never take the responsibility for your decision. I get this question a lot: Dr. Avnish, if AI makes mistake, then who is responsible? The answer is clear in your brain, in your mind. It is you, and it should be you, and you should take the responsibility, because if you don't take it, then you will be replaced. You have the license. AI doesn't have the medical license to practice. Okay, so always take responsibility for decisions. If you are not comfortable with any AI tool or any AI recommendation, please don't use it. Please overdrive. Feel free to override it. But this doesn't mean don't use AI. Use AI, but if you're not confident with what AI is giving you, please apply your clinical judgment. Remember, it is always augmenting you. You are the one deciding. Always protect your patient privacy at all costs. Always de-identify, even if it takes a lot of time. Don't put any AI information into AI, any patient report which has patient name, phone number, patient identifiers, patient face. Always remove all those, and always verify every dose, every guideline, every citation. I think I will leave you with this and hand over to Dr. Deepak. Sorry, Dr. Deepak, if I overshot a bit, but I am the opening batsman, so I have to open on a right foot, and because this is new for people, so I was going in more detail. So now I will stop sharing and I will hand it back to Dr. Deepak. I will make him the host again.
So it was a very wonderful beginning of the AI course, Dr. Avnish. You're clearly mentioned what not to do, what we should do, who is our responsible. So how we have to get prepared in general with AI. So with this, we move on to the next subject. The main initial thing what we is EHR, that is electronic health record. So I will start sharing my screen. Is my screen visible?
Yes, it is opening. Yes, we can see the screen.
Slides also, no? You can
Yes,
see my slides?
yes. You can go in full screen. Yes, we can
Okay.
see. Okay.
So I will make very short because we have three important demonstration of the real world softwares who are leading in India. So building a digital foundation in your clinic or a small nursing home or a bigger hospital, so you need a electronical medical record, electronic health record, and also some digital hardware that you have to need. So this is a module which covers how you get ready for digital readiness. That's the introduction. Then comes EMR and EHR. What is the main key differences? Why we need it? And what are all the software features that you have to expect from your vendor? And how to adopt practically. That is very, very important. And most of the doctors are very poor in typings. So why to mitigate, how to mitigate that? What are all the pitfalls of using this digital technology? And what is the next future of electronic health record? And what are all the take-home messages? So, not going much into the theory, this IT revolution you are seeing in front of here since last half a decade or so, how the changes are going, having this digital technology in the COVID time, the WhatsApp online medical courses, online education courses, webinars were doing. Now the vocabulary is artificial intelligence, Internet of Things, cloud services, big data, machine learning, quantum computing, all those stuffs which are new things. And Government of India has taken a very big lead in and also the state governments are making the Minister of AI. Now in Tamil Nadu and Kerala, they have started their own ministers of artificial intelligence. Such a amount is invested from private partners as well as from the government. So now it's a time all of you become AI enabled. If you don't, as Dr. Avinish said, other people will take over. I think you people are very fortunate enough to join the beginning of this course, and if you see in the next few months, there will be exponential demand for these courses. So coming to the EMR and EHR, electronic medical record, it's just a digital version of a patient chart. Okay. Along with the EHR, it has got some additional component which has got a interoperability value. It shares the information across the different organization system. You must have heard about federated learning. Different hospitals have got connected with each other so that the data of the patient should not get leaked. So the main difference, EMR means it's defined a small server with a regular workflow, what we do it in our clinic. Whereas the EHR, it's an integrated network of hospitals where you can do play around with the data using this AI tools. So that is the main difference between EMR and EHR. What we are all using is EMR, not EHR. What the AIMS institutes, what the Apollo groups, what the other big institution, especially in US and all, that's the EHR. But essentially, all are same in terms of quality, but in terms of quantity in the big volume, EHR leads. So that's the main advantage. So coming to the advantage of EMR and EHR, there is an improved care and safety because lot of medication errors are there. Poor handwriting is there. Nowadays in Instagram, you are seeing some scribing and all to check the pen. The other lady from the medical shop gives some medicines by reading that. So all these Instagram reels, carousels are going on. You must have seen and laughing it, but it is truth. Some people are coming out, some people they are not coming out. So it gives a efficient documentation, care coordination, quick analysis. All these things will be helpful by using this EMR. So features of practicing management software that you should look for is, it should be very easy to use, very easy to log in, and it should give complete information about all the pediatrics related, because pediatrics is the one where you have lot of other histories, examination findings will be there. None of the other subject will have that much of, because nutrition history, developmental history, vaccination history, consanguineous history, all those things will be covered in pediatrics. That is why I always prefer the pediatric software for the most comprehensive software. If you use pediatric software, you can use it at any domain. Just you have to want to customize it. That is how initially IAP software was curated by most of us. Samir Shah knows, many of you know. And now the stage of that IAP software as a RAY-AXON or something is a different variety. Of course, the operation and trust, it should be a smart appointment system will be there. Now online system is there. Security features should be there. I told you about protected health information, that should be there. It should be more than 5-6 computers connected with your lab, your ward, your pharmacy, your reception. 5-6, it should be compatible. All those questions you are supposed to ask the person. There are some people are still getting admitted. I'm very sorry. Yeah. So there are some questions you have to ask the vendors, even the 3 vendors who are going to demonstrate. Some of the questions what we are, you go through these slides, take your time, then you decide which one is suits for you. So installation, what is a offline software, what is a online software? Initially what we used to do, IAP software is a offline one. Now because many doctors in metros, they are moving around every time, they cannot carry the computer with them. In a tab they can carry, but the cloud should be, the software should be on the cloud. See, that is why depending on your need of hour, you can take a offline one and online one. Nowadays the fashion is going for the cloud one. So once you go to the cloud, always think of your data security, your patient's data security. There are some pros and cons. There can be data loss in both of the forms, but when you take regular backup of your data at the end of the day with your pen drive or a dedicated hard disk or in a Dropbox or cloud form, I think your data is not going to lose, because since last 25 years I have more than 25 lakhs data, both inpatient, outpatient, pharmacy, lab. So now I can play around with any AI tool. I can make my use my data to make any AI model. That is the advantage of huge data with you. So step 2 brings into practice, always you have to analyze the differentiality of the software by assessing and planning. First you learn by yourself about the software, being a doctor, then you train your staff. So it doesn't come in one day, it will take few weeks to months. By using a cloud sharing platform, screen sharing platform with the software vendors, you can do it. Then comes the data migration. Say for example, this 1 year I used one software A. Somehow I'm not happy with the vendor, somehow I'm not happy with the features, I want to change over. Then you should be able to ask the vendor to give my all data, and you should be migrated to the another software which is useful. So that is the first question you should ask to your vendor. And configuration, customization as per your need. It can be done, and it can be integrated into your system of computers, whether it is a Mac, whether it is a Linux, whether it is a Windows. Then always it should come go live. Especially when you are educating the patient, it should come live in front of that for educating material along with the software. And by using software, you can in real time, you can able to send the health education material prescription to the patient's mobile. Since my hospital is a Go Green hospital, I send all my prescription, discharge summaries, lab reports to the patient's WhatsApp or Telegram. I have integrated it. Then should be a regular annual maintenance support system should be there from the vendor. There should be, as I said, compliance security. All these things, steps, all the slides will be shared to you. You can go through slowly and you can find out. There are pitfalls and challenges of digitalization. Once you become into the digital world, nobody can 100% keep you from hacking. Even the Apple operating system has been hacked from jailbreaking network. So nothing is 100%. If I'm talking here, somebody must be listening, but I do not know. So that is what you should be able to see all these pitfalls, interoperative, what I told you, and clinical workflow disruption. So by having a community of your own pediatrician, you should ask, if I'm going for this A software, what are all the plus and negatives? You find it out. In a B software, what is also plus? So if you are in a digital community, you will be knowing and cross-checking, and your return of investment and your way of investment will be fruitful. So future of this electronic health record is AI-enabled machine learning software, robotic automation, predictive learning, all those things, genomic integration. You can integrate many things like what Dr. Avnish told, integrating the connectors from ChatGPT to other or Claude to others. So carry home message with this, EMR and EHR soon be standard. It is already standard, and you are going to get a notice from the government of India to start these services in your hospital as early as possible. Otherwise, we are going to lose our license. Already this ABA has been given, each and everything has been told. Next, the thing is uniform ID for each and everybody. If I am a patient, if I go from here to Bangalore to Gujarat, if I show my ID from the beginning of my birth to the till now, all the medical data will be there, starting from lab, X-ray. See, that is the advantage of uniform ID, just like your Aadhaar card or your any digital anything from government. So it will be very easy, and it will be carried, and it will be there adopted each and everywhere. So coming to this, next, the flow of after this, another 60 minutes, I have given you the overview. I will show the Glass Health. I think I have put it in the WhatsApp. If anybody has not downloaded, you can go through the videos and download it, and you can show it. Then we have from AXON, Mr. Dhaval is going to show you. From Ika Care, Imtiaz is going to show you. And from Health Race Srishti, or Mr. Rahul is going to show you the demo. So with this, so I will move on to this Glass Health. So this is the Glass Health platform. So this is the Glass Health. You can see here. So this is the window. You can log in through your email ID, or you can create an email ID. So it will ask what is your role, what is your specialty, everything. You have to fill it up. See here, the art of scribing comes. So if you click this button, it is going to record the voice. So here, if you click on the start scribing, now I am taking a medical case. How it is giving to, as Dr. Avnish told, it is not only giving you a clear-cut health record, but also it will give you differential diagnosis, differential management ways, how we are going to see on live. Are you able to see my screen?
Yeah, yes, we can see. Yes.
So we'll start scribing. Yes, I am Dr. Deepak Chirdoni. I am a 25 years experienced pediatrician from South India. Here I have a case, a male child of around 10 years old, came with history of 7 days fever with rashes all over his body, hands, palms. It's a maculopapular red rash, which has appeared 3 days after the fever. And that boy has around 103 degree Fahrenheit, degree centigrade, 3 to 4 times a day, along with chills and rigors. And they have shown to some local doctor there, and he has been prescribed some antibiotics. So can you give me a good electronic record of this patient along with the differential diagnosis based on only the history I have told? So with this, I am stopping. So in the right side, you see here, instantly it has given the differential diagnosis. It has given differential diagnosis as a viral exanthem, Kawasaki disease, scarlet disease, drug eruption, MIS-C in case of COVID, meningococcemia, and it has recommended me the next steps. You have to do the focus examination, just like your professor or your assistant teacher or anybody who is describing you. See, this is the power of artificial intelligence. So you are using a electronic health record which has got a scribing. I have not done anything typing in front of you. Just I switch on my mic, I told to scribe it, I told the history. See, this is the power of history it is giving. Similarly, you can give examination findings, you can tell the lab, and also you can able to, I will show you in the screen. See here, you can give a context. You can add a, see here, you can add a context by uploading the lab values, everything. One caveat is you should not reveal the patient name, patient's mobile number, patient address, or any hospital ID in any AI chat box or any chat GPT or anything. So this is a small example of showing this Glass Health AI. Why I'm not telling you, it's a very costly one. Even I don't have a pro version. It's a very costly because we are paid in rupees, not in dollars. If the next thing, if the patients are going to come and play in the dollars, definitely $180 per month is not a big amount for us. I think with this, I hand over to the next demo session. Dhaval, are you there? Please raise your hand.
Yes, I am here.
So I will make you to share the screen. You can ask me to share the screen. I will.
Okay.
Can you do it?
Let me.
Yeah, you can start
Okay.
screening. So over to you for next 15 to 20 minutes.
Sure.
We can. Okay, right. Start.
All right. Thanks, Deepak, Dr. Deepak. Good evening and thank you everyone for joining us today. I'm Dhaval from Dot to Dot Infosort Technologies Private Limited. I am accompanied with Bijal Joshi. We are here, a healthcare software company, already explained by Dr. Deepak, that has been building the product exclusively for clinics and hospital in India for more than 2 decades. Today we serve over 4,500 healthcare clinics across the country, and from solo practice to multi-doctor clinics and hospital. Our work is offline first by design because in real Indian clinics, reliability, speed, it matters more than anything else. In next session, we will walk you through the flagship product AXON, show you the two short demonstration, one from the clinic side and one from the patient side, and talk about what AXON differentiates from anything else in the market. Finally, give you the preview of what's coming up next in AXON 1 Plus. Okay, let me start. So let's start with the product itself. AXON is our flagship desktop software for clinic and hospital, designed around the way Indian doctors actually work. It is an offline first, so it does not depend on your internet connection during consultation. It covers your full clinic operation in one plate: OPD, IPD, prescription follow-ups, billings, accounts, and pediatric modules like growth charts, vaccination. But there's a one thing I wanted to remember, that AXON, above everything else, AXON is hybrid solution. The desktop software is paired with the patient app, which is a live on both Google and Apple Store. The two are connected, connected pair with our software in real-time synchronized mechanism. We have launched this several years ago. Nobody else in the Indian clinic software market was doing that. Your patient can book an appointment from their phone, make the payment online, and then the appointment is show up directly into your AXON software without anyone in the clinic having to enter that. This single connection changed the way front desk and the consultation room works together. We will show you the both halves of the story in the demo. Okay. Now, let me just show you the demo. What happens inside the clinic? I wanted to show you the AXON desktops running through the normal patient journey from the moment the patient walks in the moment and they walk out. Watch how the patient is registered at the front desk, complete the demographics, and record the record open for the doctor screen, and how the OPD visit is captured, and with the complaints, examinations, notes, patient. If there is a new patient, I'll just first of all register the patient. If there is an existing patient, I can just choose the patient. So here we are capturing the demographics of the patient, which needed a minimum demographic. It's not like everything is needed, only the name and case when the mobile number is something which is in date of birth for the pediatrics. Okay, so let this get done. Let me just put this little far. Yeah. Okay. So I registered the patient. Now I'll open the appointment window where I can choose the patient by case number or even patient name. And then this scheduler is something which is designed by doctors themselves. They can customize your schedule based on your timings. Now I'm entering the birth weight, height, whatever the information we capture in the clinical, and book the appointment. As soon as I book the appointment, I can also go ahead and create the receipts. Now in many clinics, we create the receipts, payment receipt in advance. They have a format like they wanted to capture the money advance, and then only they send the patient inside the chamber. And some of them are following the reverse way, like once the consultation is finished, doctor will decide whether to charge or not. So both the versions are possible. Now I'm logging in as a doctor in the same software. Now I see the my OPD screen where it has so many informations where I'll get a more better view on a plate. Then I'll select the patient from the OPD screen by clicking on the appointment, and I can see the patient is coming in. I'll select the patient and started entering the other details. If the one thing which I wanted to capture, like other vitals, temperature, pulse, and other things. So you can see that we have both the version manually typing, or you can choose by a selection, so that you can also do it by the mouse click. And this is the area where you can prepare your clinical notes. These are the notes customized by yourself, and you can change also. We give the predefined pre-filled, but you can also change by yourself. This gives you an opportunity not to type anything, just click on the clinical notes templates, and you can able to write all those things and prepare a good qualitative clinical notes. Then you can decide your diagnosis. We do support the diagnosis with ICD codes, so that is something you can add. Then medicine space, so you can now start adding the medicines. Medical medicines are getting calculated the dosage as per the birth weight. If the configurations are added in the medical master, then it will calculate the dosage. But in case they don't, you can still set it by manually by selecting the dosage, frequency, days, and quantity. And even you will get an instruction in case you don't wanted to set the dosage, but you wanted to just plainly your instruction that okay, 5 ml 3 times a day or something like that. That also can be provided. And then you can add advice. You can also set the follow-up visits, and you will get an opportunity to print the prescription in multilingual. So it supports 4 language by default, and 2 additional language you can add as per your choice. And this is how the prescription format will look like. You can see that generating a prescription will not take more than a few minutes. If you are doing it frequently, then you can do that. Now I'm moving to the vaccination. You can also generate the vaccination schedule, and then you can manage the inventory, and you can also give the vaccination for the patient. Okay. So this is also something it is supported on your single screen only. Okay, then investigation. In case you wanted to suggest an investigation to the patient and say that, okay, go ahead and taste this one, you can also give a printout of that so that they can go ahead and make the printout. This investigation can also be added into the RX so that you don't need to do a extra. Now, in case you wanted to do an admission, then there is a possibility that in case we are not only doing an OPD, but IPD also. So you can also admit the patient from the same single screen only, that admit, and then the wards can display where you can admit the patients, and then you can perform the day-to-day admission forms will be there, and then you can also enter the day-to-day entries for that patient, and you can also generate summary. For indoors, we do have the billings, payments, and all those things are also there. So you can see that we are just entering the details for the patient on a indoor day-to-day summary, that what we have given orders. Then these orders can be also printed for nurse. And then billing piece. So from where you can generate the bill once you are, maybe you can generate the bill on a day-to-day basis, or you want to generate it on a last day when you are discharging the patient. At that time, you can generate the billing, and you can also raise the receipt against that. Okay. These words are something you can also customize. Whatever words you have in your system can be generated. And now discharge summary. Discharge summary is also, we are having all the full templates, like all the sections are available, where again you will get an opportunity to type any things like clinical findings, presenting complaints, reason for admission, then pro diagnosis, final diagnosis, course after admission, past history and family history can be coming automatically from the patient history. And at the time of discharge, you wanted to prescribe something, again you will get a prescription section over here in again in a multilingual fashion. And then you can also discharge, you can also print the discharge summary, again that will also come in a multilingual, like in case you wanted to print the medical related instruction in a local language, so that is something you can do. Okay. Yeah, so you can get an option for a language as well. Yeah, that's us. Okay. Then right, so this is about discharge. Okay. Yeah, here is the discharge summary we have printed. Now, yeah, this is about in case you wanted to discharge the patient, you can select the reason, like why you are discharging. In case you have a different reason, you can select that as well. All right, and this is where you can quickly save the patient, and you can also revive the patient again. This is where you can see the growth charts. These are again like have as per the IAP has given the growth matrix, so we can display that. This is the past history. In case you wanted to take a hard copy of the prints, you can take these printouts of the all the history along with the discharge summary. This is just for the reference. In case you wanted to keep those medical legal history, so printable formats are also available. Okay. Yeah. And this is where you will see all your today's patient, that how many patients you have seen today, what are the charges. So in case you wanted to collect the amount from the reception, it's the cash amount. Okay. And this is an accounting report, which is useful for the CA, like how many payments you have collected today, and what are the heads and what are the amounts. So this is something an IT department needs that form. So that is something we also already prepare that. Yep. All right. Yeah, so I think pretty much this is what we do in a offline software. Now let me move to the next slide, which is about the patient things, like how what we do as a patient. So second demo is like what happens when the patient is there. This is the half that most other clinic software in India does not have. Like the Axon patient app is live on a Google and Apple. The patient downloads it, finds your clinic or scan your clinic code from that, and they can book the appointment, they can pay the consultation fees, and they can see the doctor slots available, and they will get a reminder also, and their appointment gets added into the that one, and that gets synced to the Axon desktop. Let me just start this one. So consider that this is the Axon app, and you will see one important things there. So let's see, the patient is opening the app first time. In case they are doing first time, they have to register themselves, they have to type their names and provide the mobile number, and they will get an OTP based registration. So once the patient are registered, they are able to can book the appointment. And now they will have to enter the code of the doctor for which they wanted to book an appointment. So this app will become very limited to for that doctor only. They will not see any other doctors or any other thing. So this becomes a personalized app for that doctor. So this code is a unique code which doctor can provide their patients via link, SMS, or even a QR code. They can have the QR code in their clinic where from there they can scan. Now you can see that this is how the main screen will look like for a patient. They can select the doctors. These doctors will be only that hospital doctors, no one else. They can select the slots. Again, these slots are same as what we have in Axon desktop software. They can select the slots, and then they can add the patient names. In case they are already registered with that mobile number in that desktop software, they will able to see their names automatically. In case they are not registered, they will able to do that, and they can book the appointment. Appointment gets booked, they will receive an SMS, they will also receive the confirmation, and they can also see this as a reminder in their calendar or also in their events that okay, we have an appointment, and they will get a reminder on that day as well that you have an appointment booking. So this is what a simplistic approach is given. Now here we have that configuration that some doctors don't want to capture the money in the advance and some doctor wants. So that flexibility we have provided, that if you don't want to capture any money, that's okay. If you wanted to, then we do support the payment via Razorpay, where you can configure your Razorpay gateway. We are not partnering anything with that. You can configure that and it will be directly in your account, not our accounts. Okay, so that is what the key here, that we give you your app, it's not our app. Okay, so this is about the app. Now let me just give you a quick view that now that you have seen that both the slides Axon in action, and let me pull out some of the things that genuinely makes the Axon different from other clinic software in the market. First and most important, the hybrid model, desktop plus patient app is important, and it's the real-time sync. We are the first company in the market to ship this. Even today, most of our competitors only do half. Second, offline first, reliability. Your consultation does not stop because the internet drops. Third, 25 years of trust only for the healthcare with over 4,500 live clinics. These are not generic CRM bent into the clinic shape. Fourth, deep pediatric support, growth chart, vaccination tracking, milestone, child-specific follow-ups built in from the day one. Fifth, complete clinic coverage in a one product, OPD, IPD, prescription, billing, account reports. You are not stitching three dots together. And sixth, designed for an Indian clinic workflow. The screens and prescription format and billing structure and language all match how your clinic actually runs. Now, what is next? So now, since we know that everyone is looking for a cloud-based solution, so now let's talk about what's coming up next. We are currently in a validation phase of Axon 1 Plus, which is our new cloud-based software solution is coming into the market. This is our new cloud-based native platform, a full evolution of Axon that will eventually replace the legacy desktop for our clinics ready to move to cloud. So it's an optional things. If any clinic want a cloud-based solution, they can choose Axon 1 Plus. It is designed to scale all the way from solo doctor to full multi-department hospitality. We already today the platform delivers complete clinical suite, patient record, OPD consultation, and structured prescription, multi-payments, billing, IPD admission, discharge, and detailed report, all from the secure cloud you can access from anywhere. Coming next is a strong patient engagement layer, online appointment booking, payments, WhatsApp integration, SMS, email, built-in teleconsultation, image and document capture, smart follow-up workflow, and on the platform roadmap, we have a AI-assisted in-app guidance to support, and the pediatric vaccine module with the full schedule and inventory. We are going to work on ABA integration, NABH compliant, and tele integration, and other multi-clinic chain support as well. So this is what we are coming up, and I would just like to show that this is not something we are just talking. The last thing, everything just I described in Axon 1 Plus is not just a roadmap, but it is being built. So you can see that these are the real screenshots from the actual software which we are currently validating. You can see that the OPD queue, real patient record, patient registry, consultation screen, multi-payment receipt, vaccination master, clinical notes. There are not mock-ups. These are running from the small set of validation partners right now, and we will be opening up more broadly later this year. If your clinic is interested in being one of the early validation partner, you would like to hear from you, and we'll be happy to answer your questions on that. These are the contact details. You can contact us, and if you are interested in any of the software, whether Axon desktop or whether the Axon 1 Plus cloud-based solution. Yes, open for a question.
Thank you, Dhaval. After another 2 demonstration, we'll take the questions, because once the participants all the 3 softwares, they will have some idea. They will note down the questions, and all the 3 demo people can answer the questions one by one. Is it okay?
Yes,
Dhaval,
definitely. Definitely, it's okay.
So we will next invite Mr. Yogesh Bolar. Are you there? You asked me to share the screen. I will give the.
Yeah. From my hello everyone. This is Yogi. Yeah, this is Yogi Deepak sir. From my team.
Yeah, who is there to share?
Dishi from my team. Dishi.
Yeah, Dishi, are you there?
Yes, sir. Hi.
Please ask me. You can share the screen. Otherwise, it will ask. Yeah, you can start.
Yeah, okay.
So this is one more vendor, HealthRay from Surat. So please listen to. Yeah, we can see your screen.
Okay.
Yeah.
Yeah. Hi, each and everyone. Good evening. So here I'm from Health Ray Technologies. Okay. So this is our website where you can see we are compliant from any beach, everything, every compliance we are having. Okay. So these all modules we are serving like OPD, IPD management, from OT management, HRMS, accounting, everything can be managed. Okay, from the single platform. Okay. So we are also having our own chatbot option, like you can walk through with it. Okay. I'm just showing you how our software works. Okay, so this is my software where you can check on the left hand side panel. We are serving this calendar, OPD, IPD management. We are having like all the modules we are having till HRMS, WhatsApp integrations. Okay, everything is there like store management. And along with this connection, we are also having our own pharmacy management software and the laboratory management too. Okay, in laboratory we are serving both the sections, pathology and radiology. So I'm just going with the calendar part, how reception can books the appointment, can do the assessment and everything. So here we are having an option for the adding a patient. Okay, if it is a new patient, we can go with the add patient, and if it is a follow-up patient, you can just search with the patient name, or you can search with the number, or you can search with the unique ID. So just I'm showing you a registration page over here. So as it is a ABA compliant software, if patient already having their ABA card, no, you can just write their mobile number. So the details will be fetched automatically. And if it is a new patient and does not have any kind of ABA card, you can just write the name, the date of birth, and along with the mobile number, you can just generate the ABA card. And this page is again customizable. The doctor can the admin can directly customize the form from the setting itself. We are giving you the customization facility from your own screen. Okay, you can customize all the things, what are the details you want over here, which should be mandatory and everything. So by just booking an like follow-up appointment, so I can just show you the details, summary of the patient. So just searching with the patient name. Okay, going with the patient name Dishi Kothari, which is of 4 months. Okay, I can just see when the patient has last visited, what was the previous payment. Okay, everything can be. And you can just select the doctor name. Okay, I'm just selecting under Dr. Yogesh Ballai, the patient is going to be treated. I want to create a bill. I can just mark as a create. So your appointment will be booked, and your like billing section will automatically generate it. Okay, and if you know like you want to give any kind of vaccination or anything, if you want to add any kind of bill, no, you can add from here itself. Okay, I just saved the bill, and right now I'm just taking a consultation fee from the patient. I have just saved the bill. You will get the invoice page, how the patient is giving you amount by cash, UPI. And here in this screen we have set the payment link also. You can even share a payment link to the patient directly on their WhatsApp through Razorpay account. You will get the amount. Currently I'm just using a cash over here and just giving save and print. So your receipt will be generated. Okay, you can even share this receipt on WhatsApp or email, or even we are having our own mobile application, so patient can check the same receipt digitally on their app. Okay, even they can book the appointment from the application. Okay, I just taken an appointment of the patient. Okay, if the doctor say like you will write the vitals, some of the vitals of the patient from the reception itself, so they can write the initial assessment also, like vitals, height, weight, or even they can like I've written 2 kgs. Okay, BP I'm writing down. Okay, you can customize these vitals according to your specialty. I just save the part. And as I'm showing you one video, it is of CDS. This is a clinical decision support where you can check patients come to you know, you can just write the patient assessment. Your nursing staff can write all the things, what are the vitals, what is the medical history of the patient, everything can be written from the nursing staff. Everything, the initial assessment we can say for the patient. Okay, and as soon as this all the part is done, know how doctor can write the prescription I'm showing you. So here we are having our OPD module. Okay, this is a queue management. Okay, every kind of the patient who are taken the appointment, no, you can check the time slot, at what time the patient has taken the appointment. If I want to call any of the patient, no, I can just click on the bell icon, reception will get a notification. Okay, and second thing, if you want to show the patient appointment on the token board, no, you can just click on the button and you can check the token board. Like it will display like patient name needs to visit this room number or something. Okay, they will come to your from like your cabin, and they will just click on it and they can write each and everything. So now according to the pediatrician, they can like ask us how to customize their account. Okay. Okay, so here let's say I'm just clicking like patient is having fever or something, you can just write over here fever. So if you have make any kind of group, no, you can just click on it, the all the things will become automatically. And even you can write the things from how many days the patient is having fever and something, so you can customize this question also. This whole EMR part is customizable, even the menu and the sub menu. Okay, so let's say the patient is having chest pain something, so accordingly the question will come. Okay, for the vitals, whatever your nursing staff has noted down, it is already coming. If you want to add something, you can write general examination and anything. If you are suggesting any of the report, you can just ask for the report. Now in the diagnose section, we have both the code IC11 and IC10 code. Let's say I'm searching with the code fever, so here you can check, you can, every code is coming. Okay, I'm taking the valley fever from here. Now in the RX part, main part is this, like whenever you are writing any medication to the patient, okay, as I've told you, we are also having a pharmacy software. So you just write the medicine name, it will also show you how much inventory is available in your pharmacy. Okay, now here even if you don't want to write manually like one by one, so here I'm showing you we are also having an option for the group. You can make multiple groups. I'm taking the patient is having cold, so all the coming up over here, all the medicines. And for the dose calculation, we are here, you can check according to the weight, you can just calculate the dose, what should be a dose according to the mg, or at what purpose you want to check, per day, per dose, how much mask you should give and how much drugs volume should be there. So this can be calculated according to the age, according to the weight of the patient. Okay, so here you can write the medication. If you want to give any tempering dose, no, it is also available. Like we can just add the dose, like the dose should be taken after the 5 days should be this. So I can also add any dose if you required. Okay. Even you can give an advice, this kind of advice we can give, whatever frequently you are using, no, it will be coming up over here. Follow-up is already set after the 5 days. I'm just showing you how prescription looks. Okay, so I'm just showing you there are multiple formats. Okay, you can customize the screen also, the print setting also, everything can be customizable. So whatever things I have noted down, it will be coming up like this, the patient name, history, whatever you have noted down, whatever medicines you have noted down. And it is multilingual. Okay, so whatever patient knows the language, no, you can change the language also, Hindi, Gujarati, any of the language. Okay, and for the even whenever a patient growth chart will also come, growth chart, vaccination, everything can also be mentioned. Okay, and now I'm showing you currently I just shown you how doctor can write like by clicking the buttons and everything. Second option is voice to text, like AI we are integrating, so doctor and patient will just communicate. Based on the communication, AI will make the recognize all the things whatever you have communicated, and it will generate the prescription accordingly. Okay, so we are also having the AI over here, voice to text button. Okay, now here in the three dots we can even check the vaccination. Okay, you can also customize like under this category the patient is falling. Okay, so on whatever doses you are giving, you can just mark like yes, this dose has been given. So you can update it like yes, I have given this dose, which brand I have given, on which date it is done, so I can just mark as given. Okay, and even the patient are getting the notification, like you are having today you are having this kind of dose. So dose reminder, basically a dose reminder will also be sent to the patient. And the growth chart also you can check from here, we are having the growth chart facility. Okay, so even you can print it on the paper like on your consultation, or if you want to just check the dose growth chart, you can check from here. Okay, so from this here we are having the OPD part, and also along with this we are connected with the pharmacy. So whatever medicines you will write now, so pharmacy person will directly get the message like this many medicines should be given. And if you are suggesting any of the laboratory investigation, it will also be getting the order in the laboratory, you should do this many reports or something. And even doctor can check same report from their portal from here, send order button. I can check what all the orders has been done and what are done. I can check the PDF also. Even the doctor can write the investigation in the tabular format. Okay, so here we are having the option. Let's say the patient is having CBC, so you can just write the data over here and I can just save it. So it will also be coming up in your prescription. Okay. And also we are having our own IPD management software where if you want to admit any patient, we are having an option to admit it. Okay. So in the admits, okay, admission, after the admission, we are having here options like if you want case paper or any label print you want, MLC cases there, or any if any embryo form you want to fill. So these are all the options we are giving. Billing, visits whenever doctor in discharge summary. What we are having a clinical summary decision. What will happen? AI will read all the things whatever you have noted down in the visit. So it will automatically generating. I'm showing you here while creating a discharge summary. No, we are having here option here, clinical summary. So whatever you have noted down in the visit at the time of round, you can just click on the generate clinical summary. So it will, the AI will recognize and will generate all the things. Okay, so here you can check what all the things it is generated directly. Whatever you have noted down, no, it will also be coming up in the summary, discharge summary. Okay, so this thing we are having, and along with this we are also having our own mobile applications to book an appointment, to online consultation is also available whenever doctors, like patient wants any online consultation, so we are having this teleconsultation. If you want to do a video call also, you can also consult with the video call. Okay, and here if you want to chat with any of the patient, you can do a chat also. Okay, and let's consider like in the walk-in patient, whenever you are suggesting any of the investigation, like in investigation you are suggesting any x-ray to the patient or anything, no, so we are also integrating the DICOM files. Okay, so here we can also see, like this way doctor can also check from their portal what is the x-ray of the patient, or like this way we can also check. Okay, and in reporting section we are very much like vast reporting section we are having. So how many bills are generated, MIS report will be calculating according to NABH. All the TET reports are also there in our system. All the kind of tracking we can do it basically. Okay, I can check department wise various kind of reports we are having according to department wise, collection wise, daily reports. And for each and every role we are giving you the restriction. You can restrict the person, what all the role should be given to a particular person. Okay, okay, so now here we are also having our WhatsApp integration, WhatsApp AI integration. Whatever messages is going from the system, it can be gone from your number. Okay, we will integrate the your number, and directly if the patient is replying any of the thing, no, so you can from your reception and they can also revert it, they can book an appointment, everything. So I'm showing you one website over here. Okay, so this is our website. Okay, where we have integrated their whole book appointment section. Person can also buy a medicines, like directly from the sitting from the home, they can just order the medicines, like I want this medicines, or they can even search for the home care service they required. They can book an appointment from here itself. So they are all having an option. So we are also doing an WhatsApp integration. Okay, and even main thing, like at some point you are having any kind of campaigns or you want to run any campaign, no, so in this section we are having one option. Okay, to run a campaign. Okay, you can customize your group. Let's say I want to make a group, the age group from 1 to 2 years, how many patients I'm having in my like organization. I can just click on it. Mm, so within this age group, whatever patients you are having, no, it will become, you can just mark the group name and you can run a campaign, like this kind of camp is there, or something you want to give a message, so you can also run a campaign, WhatsApp campaign we can say. Okay, so basically I'm just showing you what all the services or we are having. All kind of token boards we are having, OT managements we are having, blood bank, HRMS for the payroll management we are having, MRD sections, tele-management, equipments, this all the things we are having. Okay. And what all the USP we are having is basically it is ABDM compliant, it is HIPAA compliant. We are also having the NHCX, which is called as third party insurance. We are doing that kind of thing. Okay, it is no code, low code, so anyone can customize everything from their end without depending on us. Okay, patient engagement can be done, like queue management can be done properly. Okay, and now I'm just sharing my another screen to show you patient application, how what patient can see from.
Can you wind up in another 1-2 minutes, please?
Yeah, sure.
We had
Yeah. Okay, so these all the features we are having. Okay, whatever I have shown. Okay, anyone is having any doubts?
Rishi, we can take in the last one more demo is there.
Okay,
Many
fine.
chat box, there are a lot of questions are there. Okay.
Yeah, we will
please
answer.
tell your contact number to the participants, because within 20 minutes understanding this software is very much difficult for anybody. So anybody who is interested, they will contact
definitely.
you. You have to take one-to-one demo. It takes a minimum at least 1 hour as per my concern, because here some are very new, some are using, some are very seniors. They are not digitally educated. So you have to take one-to-one and you have to show you. Okay.
Yeah, 100%. And if you want to like contact us, no, I will share you
Please show
the.
their contact number or put it in the chat box.
Yeah, I will share you on the chat box. Okay.
So all of you are included in a separate WhatsApp group, a demo. There also you can share your this thing, that I will put it in the participants.
Yeah, 100%.
So you can do one-to-one, because it has got more than 1,000 features, every software. Okay. Thank you very much, L3 team. It's a wonderful presentation. Now I request anybody, Imtiaz from ICACare, you can ask me to share the screen. I will allow. Imtiaz, are you there? Please unmute yourself. I think nobody has logged in from ICACare. So we'll take the question and answer. Yes, Dr. Aruna, unmute yourself. Please ask the questions. You have it in comment box, no? To Mr. Dhaval and are you there?
Yes, sir.
Please ask. They will take one by one your questions. You're not able to unmute?
Yes, sir. I have unmuted. I was thinking about opening my video also, sir. Yes, sir. Yes, sir.
Better you ask it rather than video, Dr. Aruna, please.
Okay.
You can ask
sir.
whatever the queries.
Yes, sir. In our hospital, we have done the laboratory automation, and we have the laboratory information system which is attached to the hospital information system. I want to know whether the CMR will have the solutions for laboratory information management system, including laboratory interface and all, so that like the reports can be updated, clinicians can order the investigations on the software directly, and the reports can be updated by the laboratory personnel through the software. So if
I
it
mean,
should
you're
be
asking
bi-directional. Yes, sir.
integration, Aruna.
Yes, sir.
Integration
Yes, sir.
of lab with your EMR. Yes, Dhaval, you
Yes, sir.
can answer first, then Dishi.
Yes, we do have such integrations. So currently we also have a two kind of softwares, which is one is laboratory, one is our desktop. We do have interfacing between two, so we can enhance this to any other software which can have APIs or match up with this. So yeah, it needs further
Dishi,
discussion, but yeah, we can do that.
your answer to this question.
Yes, thank you, sir. Yes.
From
Dishi, are you
yesterday,
there?
From Health Ray,
Yeah,
can I
Yogesh
answer
sir.
on behalf of
Yes.
the? Yeah.
Yes.
Dr. Runa, from in Health Ray, we can integrate your lab module as well as Health Ray. Patient will have a single application where they can book an appointment, also as well see all the investigation report. Doctor from the same OPD room can see all the investigation. Even you can see all the investigation in graphical format. So as a patient, if I have done hemoglobin multiple times, you do not need to go through each and every report day by day. You can just click on a table or it will present you in the date wise in the graphical representation. So yeah, we offer both.
Okay,
Yeah.
thank you. Aruna, did you get the answer?
Yes, sir. Thank you, sir.
So
Yeah.
most of the software makers, they integrate, they can customize whatever you need.
Yes.
What you need I may not need, what I need, you may not need. So they will customize it as per your need. But my request to all of you is take a demo, detailed demo, one-to-one basis. I think Dhaval and Dishi, are you going to do one-to-one demo if they want to ask you?
Yeah.
Yeah.
Yes, sir.
Fine.
Yes,
Yeah, will
definitely,
do.
sir.
So please have one-to-one demo. Take 5-6 different softwares. So see, ask for 1 month or 15 days period, grace period. Then you can decide which one you go for. Okay. So I told you somebody wants offline, somebody may want online, depending on the move, how you are going to visit and all. See, that is what the main aim of giving these two people a platform is to not to make the money. So all of you should understand. They also registered like you people. You pay the money and come. They also paid the registration fee and come. I'm very ethical and honest in part of it. I don't want to get sponsored by anybody. The thing that you people asked us how to digitalize the hospital, how we have to go back. That is why we put none of the any AA courses in the world do not start with this preparedness. I'm telling you frankly, I have undergone and I have done the courses with other platform. Nobody teaches you about EHR and EMRs. And nobody is going to give demos like this to you because digital data is very, very important. Structured data is very, very important for artificial intelligence. That all of you should know. If you have your own data with you, structured data, you can make your own models with collaborating with the technology people like IITs and all. So you will have name as well as fame, and it can be patented worldwide because India is a hub for research. Because many diseases we are not reached the Millennium Development Goal. Every time we are reaching to health for all for 2025, 35. Why? Because we are not yet reached to that bottom level. By using technology, by having a good data, I think we can reach that health for all, that Millennium Development Goal. So each and every has to put our hand to that. I think with this, around 7 o'clock, we are exactly in time. I think you people, after this, all these recordings will be in this LMS. You can again log in. You can go through each and every slide and all. We are going to add some PDFs, assignments and all. You can just learn in this platform. So you have, see, I learned from another 20 people why they could log on. They are having 5-6 email IDs and they are logging in with that. So once what you have, the ID you have given to the graphy, you have to put that. So that is the main intention. You should not get confused because I got it from the backend team. She said 5-6 people have given 5-6 types of IDs. They don't remember the password. Again, we have to do it. This is from our mistake, not from the technology. Of course, any technology doesn't comes in one day. Nobody can learn to drive a car in a day. To drive a cycle, they have to fall, they have to touch. All those things will be there. So you should have patience with you to learn. And once you use this learning platform, then you will tell Deepak, this platform is good. There are a lot of difference between the Zoom platform as well as the graphic platform. Then you can ask the AI-powered graphy in this learning platform. In this video, in 1-2 hours video, what are the things you want to learn? If what are the things we are not understanding, it will teach you. See, that is the power of AI in this platform. I know there is a lot of glitches, technical glitches. I think by the day 5th week, you will be knowing you are familiar with this platform and you are going to ask me. We will also do coaching like this in this platform. I think Shika has helped many people. I given the number and I requested her. Though Saturday and Sunday they are holiday for her, but I requested her, please be with us till everything gets solved. I think you should able to tell your friends who are not, let us not deceive other things. Everything will happen. The main idea of putting this demo platform, I think ICACare, I will give them one more chance because they have paid 5,000 rupees. I think in the next class I will give, or otherwise I will arrange one more class in the night, 9 o'clock. You people can see and say, I can, even though you paid 5,000 rupees me, it's a 5 weeks model, it is just on the books. I can take 100 more classes for you. They are not going to charge for you or me. It's your time and my time. Okay. So with this, I think you have to give some comments, critics in the WhatsApp group. See, that is how we have to learn. I think all of you should agree with me, Dr. Avnish and Dr. Samir. You want to ask something? You are putting in the chat box. Please come unmute and please tell.
No, sir,
Yes,
it's a
Samir.
really time. I think we are overshooting the time, so we will definitely discuss that thing in some other class. So nobody has to wait for the more long time. Definitely, yes. I just discussed, share this query what I have, and we will discuss in future definitely.
Sure. So thank you very much. Thank you, everybody. So we will go with tomorrow's module 1 part B with Dr. Samir Shah and Dr. Sridhar Bodapati. They are going to tell you about how to use the digital apps, how to make it AI powered, or in your tabs or in your computer or in your mobile, and new things about digital therapeutics. And we will have a short 20 minutes demonstration of a AI powered digital stethoscope tool called IuSync. It is made in India product. I think Samir Shah he has brought them into the Calcutta conference to show. I think it is a time to use the digital stethoscope. So they are also paid you like 5,000 rupees for this registration, and they have come. I'm disclosing this because I don't have any hesitation. Some people asked me, we are going to sponsor entire your curriculum. We are giving you so much. I said, no, I'm not going for that. I'm very much ethical in that. If at all, I will disclose you and I will take, but I won't take like that. So with this, we make a day for today. Thank you very much. You people have joined. So tomorrow also we will join in the same 5 o'clock exactly. Then we'll start. So please do box breathing with YouTube music by yourself. And thank you very much, Dr. Dhaval, Mr. Dhaval, and Dishi, and all health Srishti Das.
Thank you.
You have done a wonderful job. Please connect one-to-one. You will be in our community. I'm not going to take you from our Smart Access WhatsApp community. You will be there with us because many programs for general doctors it is coming. So be in this program. What I'm suggesting is show some 5-6 important highlights from other software. Then ask for one-to-one demo. That will be the better. Because if you tell hundreds of things and confuse them, tell important features and tell them to come one-to-one. Because you people will study the market, Dhaval and you know how you are better than this. So that part you have to highlight to these people, then take one-to-one. Because we are all collaborating. We are not fighting for each other. For the betterment of the people of India, the healthcare of India, that is our main motto, not money making or branding ourselves. So some or the other way, we have to contribute to the society. That is my main intention. With these words, Avnish, anything you want to tell? Speaker words? Yes.
Yeah, no, I think excellent beginning, I guess. And I appreciate each one of the participants for enrolling for this course. And see, these demos, these are to help you understand what is going on in the real world. Because see, our course is different from others. We want to show you what is realistically happening in the real world. We don't want to show you some theory and some US electronic medical record and just tell you that this is how it happens. Actually, you should feel that yes, what is happening, how to digitize my data, then how to collect that digital data, how to build my AI tool. So all this thing is very, very important. It might look that it is not so important, but believe me, without data, without EMR, without any of these digital tools, like tomorrow you will see the stethoscope also. So that is also one of the ways to digitize the heart sounds, lung sounds. So take each one of these demos, see what you can learn from it. And any knowledge doesn't go waste. This has been my experience. So with this message, I will say that each and every class try to attend. You have paid to do this course. You are spending more with your time, much more than the money. So make full use of it. Communicate with us on the Graphy platform as well as WhatsApp, and we'll be happy to help you. If you want any resource, just let us know on WhatsApp. We can prepare and put it on Graphy for you. And we are happy to even connect. Even after this course, we'll be in touch with you. You'll be part of the community. And really happy to be part of this course. Although I'm not a pediatrician, but still Dr. Deepak has involved me and made me a part of this course, and I'm happy to contribute to the future of pediatric care in India and to make it more modern and AI driven. So really happy and always there for all of the students on this course. That is my last message. Thank you.
Thank you, Avnish, for your words. So those who have missed, Dr. Shyam is joined now. Please log on to this LMS platform. Go to the course. The videos will be there. I will send you, if you are feeling any difficulty, just WhatsApp me. I think I have shared Shika's number also. Just WhatsApp her and wait for some time. She is going to teach you, help you how to assess the videos and all. Once you are accustomed that, you are not going to leave the platform. So that's my surety. With this, good night, all of you. Thank you very much for the first class. Tomorrow again, we are going to meet. Thank you very much. Good night. Bye.
Good night. Good night.
Bye.
Bye.
Bye and good night.
I'm ending the meeting.